would like to welcome Macey Smith, who is the Vice President of United Solutions, and she will speak about connecting healthcare ecosystem through consumer AI predictive assessment. Macey, welcome. Again, you have approximately 10 minutes. Macey, we cannot hear you. Please unmute.
Can you hear me now?
Yes, we can hear you now.
Hi, so welcome. Thank you so much for having me. As you mentioned, my name is Macey Smith. I'm a Vice President at United Solutions. Thrilled to be here today. Andre alluded to it a little bit earlier, but I want to walk you through an incredible infrastructure that we have built that will enable us to better respond to the global pandemic. Just briefly, for those of you who are unfamiliar with United Solutions, we're based in the United States. We're an emerging technology company that is deeply committed to the pursuit of continuous innovation to help improve the health, the global health. And just notably, we have a lot of experience in healthcare. We have
Macey, we do not hear you for some reason.
$70 to return to mission. What I want to talk to you today is about Sichi. And Sichi is actually the first federally authorized AI infrastructure. We've received the FedRAMP High infrastructure recently from the federal government, which is the highest accreditation in the federal government, meaning that we can securely share. Oh, can you guys see my screen?
No longer.
Okay. Can you see it now?
Yes, we can.
Okay, great. So Sichi enables the secure sharing of healthcare data throughout a global ecosystem. And, you know, we've heard a lot of really intelligent people talk so far, and I know we will later on in the presentation about the power of AI, but really, unless we are able to have data, AI is somewhat useless. So we built Sichi, an infrastructure and mobile application to really decentralize the global collection of data, which I also saw someone in the chat ask about. So we'll show you today how we're going to do that. So what I want to walk you through is a consumer mobile application, which is actually available now on the Google Play Store, available for anyone to download in the United States, and we're expanding into other countries as well. We want to show you how we're leveraging blockchain and AI to collect this data and provide it to organizations such as pharmaceutical companies and pharmacies and business so that they can leverage AI to help the response to the pandemic and also prepare for potential future outbreaks as well. So one of the key characteristics of Sichi and the abilities in our mobile app is self-sovereign identity. And many of you may be familiar with self-sovereign identity, but this allows users to own, protect, and securely share this data. The reason why that's important is because now more than ever, cybersecurity is a big issue and critically important. And people are very sensitive about their health data. You walk into a doctor's office, you fill out, a piece of paper which can be floating around, and your information is input into numerous databases, and we don't really know how secure it is. And we know from the dark web it's really not that secure. But allowing people to own their identity on their phone and only share with others what they want to share will make them more comfortable in entering into this ecosystem so we can begin to collect information about their health, which will only further our ability to leverage AI to improve health outcomes in the future. So people can leverage self-sovereign identity to save certain information, medical information, to their profile, and then share that securely with physicians, pharmaceutical companies, as well as businesses to enter in the future. We also leverage AI to provide an intelligent risk prediction. This is important because a lot of times we don't have data on who has received a test, whether it's positive or negative, who has received a vaccine, or even if they're interested in receiving a vaccine. So we have an artificial intelligence capability that allows users to input symptoms that they're having, where they've traveled recently, what their temperature is, if they're experiencing, anything in particular that may be unusual, as well as a photo of either their face or a certain condition on their skin to allow us to help predict if they may be at risk for COVID. And we have deployed this for other conditions as well. We're able to look at images to determine whether someone has skin cancer or a particular skin condition. So while we're focusing on COVID now, this capability is applicable to other conditions in the future. The prediction accuracy obviously increases as the amount of data that we have increases. So as we build out this ecosystem, which we need everyone here to help us do, we can further improve the predictions and also the value of artificial intelligence moving forward. For individuals as well as businesses, this can help with intelligent risk monitoring. So we have and whenever anyone takes an assessment, they're provided with a score, a percentage of what are the chances they may have COVID or any condition in the future. Then you have access to view where there may be areas of high risk around you. So you know whether you may or may not want to enter a particular building or visit a particular city if people in that area have taken the assessment and have received high risk prediction that they may in fact have COVID. This map also integrates with test centers and vaccination centers. So those who are interested in receiving a test or a vaccination, if they're unsure of their condition, can easily locate where they can do so. This also helps with those businesses, those pharmacies and those doctors' offices and those providing vaccinations know what the demand for vaccines and tests is around them. So they can leverage that intelligence to prepare for the influx of people who are wanting a vaccination. Now, in order to create this profile and attest to your health condition, we need to be able to allow users to attest to that in various ways. One is the attestation of an assessment, whether we predicted that you may be at risk of COVID or not. The second is the attestation to test results or vaccinations you've received. So you can add a vaccination if you've received one in the past, or your doctor or that person administering a vaccine can, through the application, attest to the fact that you've received a test or vaccination. That is added to your profile, and that allows you to share that information and only that information in the future if you need it to enter a particular facility or travel. It's that health passport that I'm sure you've been hearing about. Finally, and to go to the question that someone asked in the Q&A, can we crowdsource this data in some way? Well, absolutely. By decentralizing the collection of data and allowing individuals to attest to their health on their own and save that information and share it securely via a blockchain, we are doing that with Sichi. So imagine someone gets a vaccination. One of the important things that we want to know now are how are people responding? What is the efficacy? By entering every day how you're feeling, if you're having any particular symptoms like you see here, potentially a rash, or maybe you're very tired or you're feeling nauseous. Within Sichi, you can write in your health journal every day how it is that you're feeling, and that information can be shared with the pharmaceutical companies who are making the drugs, with the doctors who administered the vaccine, so that they can monitor the health of their patients and of those who are receiving drugs. This will allow us to drastically improve not only the vaccinations that are created now, but also the vaccination and drugs that we want to create in the future. Finally, there is a web app component that allows you to visualize the vaccine intelligence and leverage the AI for your organization. Whether you're a business looking to monitor the health of your employees or those coming in and out of your store, whether you are a pharmaceutical company or a hospital looking to track demand and visualize the number of people who have received a vaccination or a test. You can leverage the AI to do that. One of the things that United Solutions is most passionate about is building what we call human AI or humanizing AI. This infrastructure allows people and users, as opposed to a bunch of data scientists coming in and building unique models, we have created the ability for you to build a model on your own to derive intelligence that you're interested in from the AI. So I just want to end by saying an ecosystem takes a bunch of parts. I know there are a lot of people on the line today who are interested in how can we all work together to get over this pandemic and prepare for things in the future, such as this, potential outbreaks in the future. And we'd love to collaborate with you within the Sichi ecosystem to help us respond to the pandemic and decentralized data collection.
Well, thanks a lot, Macey, for this helpful presentation.